frequently asked questions about orthostatic hypertension. What is orthostatic hypertension? Orthostatic hypertension is defined as a decrease in systolic blood pressure of 20 or a decrease in diastolic blood pressure of 10 within 3 minutes of standing when compared with blood pressure from the sitting or supine position. It results from an inadequate physiologic response to postural changes in blood pressure. What are the symptoms? Orthostatic hypertension signs and symptoms include feeling lightheaded or dizzy after standing up, blurry vision, weakness, fainting or syncope, confusion, nausea. What are the causes? Many different conditions can cause orthostatic hypertension, including volume depletion, heart problems, cardiac arrhythmias, valvular heart disease, ischemic heart disease and heart failure, endocrine problems, thyroid conditions, adrenal insufficiency or Addison's disease, and diabetes insipidus, nervous system disorders, Parkinson's disease, multiple system atrophy, Lewy body dementia, and pure autonomic failure. After eating meals. Some people experience low blood pressure after eating meals or postprandial hypertension. This condition is more common in older adults. Medications. These include medications used to treat high blood pressure or heart disease, such as diuretics, alpha blockers, beta blockers, calcium channel blockers, angiotensin-converting enzyme inhibitors and nitrates. Other medications that may increase your risk of orthostatic hypertension include medications used to treat Parkinson's disease, certain antidepressants, certain antipsychotics, muscle relaxants, medications to treat erectile dysfunction and narcotics. In the absence of volume depletion, younger patients with orthostatic hypertension usually have chronic autonomic failure. What are the complications of orthostatic hypertension? Persistent orthostatic hypertension can cause serious complications, especially in older adults. These include falls. Falling down as a result of syncope is a common complication in people with orthostatic hypertension. Stroke. The swings in blood pressure when standing and sit as a result of orthostatic hypertension can be a risk factor for stroke due to the reduced blood supply to the brain. Cardiovascular diseases. Orthostatic hypertension can be a risk factor for cardiovascular diseases and complications, such as chest pain, heart failure or heart rhythm problems. What is the principle of evaluation for orthostatic hypertension? Evaluation of suspected orthostatic hypertension begins by identifying reversible causes and underlying associated medical conditions. Head-up tilt table testing can aid in confirming a diagnosis of suspected orthostatic hypertension when standard orthostatic vital signs are non-diagnostic. It also can aid in assessing treatment response in patients with an autonomic disorder. What are the goals of treatment? Goals of treatment involve improving hypertension without excessive supine hypertension, relieving orthostatic symptoms, and improving standing time. What does non-pharmacological treatment entail? Non-pharmacological treatments include lifestyle changes, including drinking enough water, drinking little to no alcohol, avoiding overheating, elevating the head of your bed, avoiding crossing your legs when sitting, and standing up slowly. If the patient does not have high blood pressure, the doctor might suggest increasing the amount of salt in the diet. If blood pressure drops after eating, your doctor may recommend small, low-carbohydrate meals. Compression stockings. Compression stockings and garments or abdominal binders may help reduce the pooling of blood in the legs and reduce the symptoms of orthostatic hypertension. What does pharmacological treatment involve? For patients who do not respond adequately to non-pharmacologic treatment, fludrocortisone, which is a synthetic mineralocorticoid, midodrine, a peripheral selective alpha-1 adrenergic agonist, and pyridostigmine, a cholinesterase inhibitor that improves neurotransmission at acetylcholine-mediated neurons of the autonomic nervous system, are pharmacologic therapies proven to be beneficial.
Audio Jungle. Audio Jungle.